I feel like the most underrated reason for constipation is that dyssynergy of the beautiful orchestra, what you talked about. We call in medical terms as dyssynergic defecation.
Yes.
I want you to explain this complex term to my audience in a very simple way.
See, in this symphony, if some instruments are played wrongly, it's not in tune. Suppose you have percussion which is fighting against the wind instrument, you don't have a good symphony. You don't have good music, isn't it? Likewise, the dysenergy happens when I told no, some muscle has to contract, some muscles have to contract, and the pelvic floor has to relax. What happens if the pelvic floor muscles also contract?
It will not come out.
It will not come out. They try to compete with each other. In the process, the motion will not come out. All the bowels, they compete with each other. What is supposed to be a symbiotic, coordinated movement, they fight against each other. That's the main problem with this obstructive defecation or dysenergia. We may call it as in our medical terms, but what happens is there is a complete disharmony between what is supposed to relax and what is supposed to contract. What happens if both of them contract? What happens if both of them relax? That is what happens in obstructed defecation syndrome or pelvic floor dyssynergia.
So in my patient population, you will not believe, mainly women, 50 to 60% of patients are because of this lack of harmony.
Correct.
And not lack of fiber. And we do anorectal manometries and we identify that, okay, so this patients will not get benefit no matter how much amount of laxatives that we do.
In fact, it will worsen the symptoms.
It will worsen.
Yes, because see, laxatives and bulk forming the fibers, that means you are producing more stools. So more residues, meaning the muscles have to push more. Already the muscle is not working. See, already a container is not working. You put in more stuff, and how it work? It will worsen. Somebody, we also do trial and error. If somebody before manometry, if I see that I wanted to check, I provide laxatives and especially bulk forming. If they get relieved, yes, it's because of lack of fiber. If it gets worsened, it's dysenergia.
Lack of harmony.
Yes, lack of harmony.
Yeah. So in my practice in the US, we refer these patients to something called biofeedback. As we were discussing. Okay. So I want you to educate the audience.
Yes.
What is biofeedback in a very simple terms?
Let me explain. So I told that there is disharmony between the muscles which contract and muscles which relax, isn't it? After finding out through anorectal manometry, okay, this is the problem, then we involve some of our physiotherapist, some of it's basically a digital treatment. Why I say digital treatment? See, you are I would say a digital doctor. You have created revolution in the world by by providing lot of information. We are in a digital revolution. Likewise, I can say this biofeedback is one of the medical digital revolution because people need not be there in the lab or with the physiotherapist every time. Initially, they have to learn how to make the pelvic floor relax.
Because it is contracted.
It's contracted. So it's like a form of physiotherapy. When somebody is having stroke, they have to make use of the physiotherapy to bring the muscles back.
Correct.
Likewise, this pelvic floor muscle is already contracting. So we have to educate. As I told you, it's not in our hands. It's a training we have to give. So using the very sophisticated transducers and some visions. See, suppose if you have a stroke, with power we can use our hands and legs. But whereas pelvic floor requires some sort of simulator, some sort of visual things to make sure that we are having a command over the pelvic floor.
By looking at something, you are aware of what is happening inside.
Yes. It's basically we are training our pelvic floor muscles to relax and to contract based on the visual scores. So that's the laboratory training. See, in about 10 days time, they know how to contract, how to relax. It's like a swimming. See, when somebody who doesn't know swimming, in about 10 days' time, we learn the swimming
Correct.
or driving. Like that, we know how to control the pelvic floor muscles by this biofeedback. Initially, I thought something is different, but once I learned this, okay, this is a form of learning, making our pelvic floor muscles to learn when to contract so that we know. We have a control over the pelvic floor. When somebody pushes, we have through some maneuvers we try to relax. Already, which we have already trained in that training sessions, and we can practice at home. So that's why I call it as a digital treatment.
Digital treatment.
You learn it in few contact sessions, and then you can go for training yourself for long so that you produce good results.
So in my practice, sir, we see this biofeedback helpful for both constipation and also incontinence when people are having fecal leakage and urinary leakage sometimes as well. So fecal leakage, fecal accidents, you will not even imagine the amount of problem that they have.
It is social stigma.
Social stigma, yeah.
Stress, urinary stress incontinence. Imagine, see, that's a big. I've seen people not going out for this, either fecal incontinence. For those fecal incontinence, in the sense leaking of motion or leaking of urine. So, this is basically a big problem. From medical point of view, it may not really, it's not life-threatening disease. From social point of view, people not going out,
Correct.
staying at homes, glued to indoors, it's a big thing. This is exactly the reverse of what we teach for constipation.
Constipation. Ah.
We make them contract more. So in
The pelvic floor needs to contract here.
yes, so that to have a control. So for it's like a gatekeeper. For some, it has to make a real, I would say, gatekeeper, so that it should not allow something. At some point, when something has to go out, it should make way. So that's the pelvic, amazing organ, I would say, pelvic floor.